One of the top questions I get asked frequently is, I have a family history of heart attack. Either my father, people will say to me, my father had a heart attack at 50 and I'm 49. And I mean, I've had my cholesterol checked, but is that all I need? My blood pressure's okay. I eat pretty clean. Is there anything else that I need? Because I'm starting to get nervous. I'm approaching the age that my father was when he had a heart attack, and I don't want to go down that path. So if you're an individual who has a family history and you've had a loved one at any age, whether they started having trouble with their heart or trouble needing stents or a health issue requiring medications to protect them from heart attack and stroke at an early age, if you have a family history of cardiovascular disease, then there are tests available to you that you can know if you're headed down that same path. And my recommendation is anyone at age 40 or 45 needs to have these tests performed so that you can understand, are you headed down that same path? Are you headed for a heart attack or stroke? Because most importantly, whatever we find, that process is reversible. This disease is reversible. You do not have to go down the same path as your mother, your father, your aunts, your uncles, your loved ones that you saw go down the path of the devastating effects of cardiovascular disease. So the tests are available. Most people that say, I went to the doctor and they just gave me a medication, or they just said I need to eat better, they'll come to see me and say that visit seemed incomplete or unfulfilling because there's got to be more. My mother did those things, as I said, and they will say to me, or my father, etc. And they ended up having a problem. So how can I be sure? You can be sure. We currently have the greatest technology, the greatest testing available to absolutely predict, are you headed for a problem with cardiovascular disease? Are you headed for a heart attack? And it's not widely talked about. Oftentimes, individuals will go for an evaluation and the workup is either incomplete or it's not looking at the most helpful tests. So maybe you've had a few tests, but they weren't the most helpful tests. In other videos, I go into detail about the testing, but just know, you can know if you're headed for a heart attack, and you don't have to go down that path. It is reversible. I'm Dr. Gina Pritchard, owner and founder of the Prevent Clinic. Please contact us for more information.